Good morning, good afternoon, and good evening, everybody. And thank you so much for joining us today for this special webinar on the People That Deliver Grand Challenge for Last Mile Health Supply Chain COVID-19 Support Program. My name is Alexis Strader, and I'm the project officer for People That Deliver. And we're very excited today to share with you all of the work we've been doing these past 6 months. So let's go ahead and get started. And first I'll go over the agenda quickly. I'm just going to give some housekeeping rules and instructions, and then I will introduce our presenters. I'll then turn it over to Dominique Winkles, my co-moderator for today and the executive manager of People That Deliver. She will be providing a quick background on People That Deliver and this program, and then she will introduce our special guest speaker, Saul Billingsley from the FIA Foundation. After that, we will dive into presentations by our 4 Grand Challenge organizations, GreenLight Initiative, SafeBoda, Transaid, and VillageReach. And then the remaining time will be available for a question and answer session. And then at the end of the hour, we'll close. So let's move on to housekeeping. Just quickly, a reminder that we are recording today's webinar and that all of the attendees are automatically muted. If you have any questions, I encourage you to send those through on the Q&A. You'll find the Q&A button at the bottom of your screen, and we'll either answer your questions live or we will type your questions in the Q&A directly. So now I would like to go over our presenters for today. We're very excited to have them here. From the GreenLight Initiative, we have the founder and executive director, Simon Patrick Obi. From SafeBoda, we have Shakib Sabuga, who's the senior manager for collaboration, partnerships, and events, as well as Desire Pamela Kalisa, who's the supervisor for food and shop verticals. From the Industrial Training Center in Zambia, we have Sarah Tanda Nangwanye, who is the Distance Learning and Extension Studies Coordinator. From Transaid, Project Manager Jason Finch, and last but not least, the Country Director for the VillageReach office in the Democratic Republic of the Congo, Freddie Nkosi. So with that, I'm going to turn it over to Dominique. Thanks.
Thank you, Alexis, and good afternoon and good morning to all. Welcome to our webinar. My name is Dominique Winkles, and I'm the Executive Manager for People That Deliver. Before I tell you a little bit more about our Grand Challenge, I just want to provide you with some information about the People That Deliver. We call it PtD for short, and we're working towards strengthening the capacity of the health supply chain workforce, but also working towards promoting the professionalization of the supply chain role within the broader health system. We found that when we first started working in this space, and that's now 10 years ago, that although hundreds of millions of dollars in commodities were flowing through a country's supply chain system, the critical strategic function of the supply chain within health systems was often not acknowledged. We also saw then that the health supply chain workforce lacked the technical and managerial competencies to perform optimally or the empowerment to affect supply decisions and policies. Many low to middle income countries have insufficient number of adequately trained staff, particularly logistics staff, to manage health supply chains. And countries face significant gaps in technical capacity and knowledge among their existing health supply chain staff. And this is often due to lack of experience or formal training, either through supply chain logistics degree programs or in-service training for staff. And so we're very much working towards filling those gaps. Our one goal is to create a competent and supported and adequately staffed supply chain workforce that's deployed across the public and private sectors within the health system. And today we're a global coalition focused on providing technical leadership in human resources for supply chain management. We provide a platform for our member organizations to share their innovative approaches so that the entire supply chain community can benefit. And at our core, really, PtD is a knowledge hub for best practices in human resources for supply chain management. We're governed by a coalition representing 7 different constituency groups. And on this slide, you can find the organizations that are currently represented on our coalition. So next slide, please. Thank you. In April 2020, we were so graciously awarded a grant from the FIA Foundation, which is an independent UK registered charity that promotes road safety, who also wanted to contribute resources to the COVID-19 response efforts. With this funding, we launched the Last Mile Health Supply Chain COVID-19 Support Program Grand Challenge, quite the mouthful, but there's a lot in there, which provided seed funding to promising projects in sub-Saharan Africa that address health, commodity, transportation, and logistics challenges currently brought on by the COVID-19 pandemic. We search for organizations with innovative, high-impact ideas looking for financial resources to help those ideas come to life. 4 projects were selected with an emphasis on promoting and reinforcing sustainable workforce development, which in essence means the development, recruitment, and retention of a competent supply chain workforce. In the case of these projects, it means protecting and safeguarding the workforce against COVID-19. You'll see here on this slide, these are the 4 organizations that were recipients of the Grand Challenge Award: GreenLight Initiative, SafeBoda, Transaid, and VillageReach. And so now I'll pass it over to Saul Billingsley, the Executive Director of the FIA Foundation. Welcome, Saul, and thank you very much for being here with us today.
Thanks, Dominique. It's a great pleasure to be here. Thanks for having me. Thanks, Alexis. I've got a huge amount to say because I think it's much more interesting to hear from the partners in this challenge about what you've been achieving. But I just thought I'd give a little bit of background, first about the FIA Foundation, and then also about why we decided to invest in these projects. So as Dominique said, we're a charity based in the UK, but working internationally, mainly on road traffic injury prevention and other aspects of sustainable transport, including air quality and fuel efficiency. We spend most of our money in the Global South, so we have a range of project partners in Sub-Saharan Africa, in Latin America, and across Asia, working on what is a much neglected epidemic, road traffic injury, but one I'm sure that many of your organizations are familiar with on a day-to-day basis: dangerous roads, uninvested in roads and safety, poor maintenance of vehicles. If you're involved in logistics, these are all issues that you'll be coming across every day. But today we're not talking about that, we're talking about the response to COVID-19. And about this time last year, just as the pandemic was hitting and we were all suddenly sitting at home, wondering what had happened to our day jobs and our projects, it was that sort of period when nothing was quite happening. We decided we wanted to help and support the global response to COVID-19. So we looked around for programs to support once our board had agreed to provide some funding. And we put some money into some of the early research into testing of COVID-19, some money into vaccine research. We've supported some research on long COVID effects, particularly on neurological effects of long COVID. But the main area we wanted to invest in was logistics, because at heart, we're a transport-related charity. We work on road safety and transport-related issues. And we thought that transport nexus for COVID-19 would be a really important one, and probably one that wasn't really being invested in by a lot of other organizations. So having had a long and fruitful collaboration with UNICEF on child road safety issues, we reached out to UNICEF for advice, and that's how we came to People That Deliver. And I have to say, I think that your name is very apt, because from our limited experience of working with you, you are people that deliver. It's been a real pleasure to collaborate. I think the projects that have arisen from this grand challenge and that we're going to hear about shortly are really impressive, are having a big impact in the countries where they're operating, making a difference. And it's really brought home to us how very important this logistical challenge is, how important this last mile challenge is. And never more so than now when we're seeing the need for vaccine distribution urgently and equitably. And that's something else that we're now looking at supporting and working out how best to do that. So it'll be great to hear from all of the partners who have been involved in this challenge. Thanks again to Dominique and Alexis for inviting me to come and say a few words today. And I'll hand back to you, Dominique, and look forward to hearing from the project partners.
Thank you, Saul. Thank you for those kind words. So over to you, Alexis.
Okay, great. Yes, thank you for those words, Saul, and we really appreciate you being here today. So next we will go ahead and get started with our presentations. The first up in the list is Simon Patrick Obi from the GreenLight Initiative, and he's going to be talking about the safety training for truck and ambulance drivers during COVID-19 in Nigeria. So over to you, Simon.
Thank you, Alexis. Thank you, Dominique. And of course, hi, Saul. It's great again connecting with you after Sweden meeting. Yes, next slide, please. So first of all, I would like to talk a bit about who we are. We are GreenLight Initiative. We work to promote transportation safety and sustainable development. Next, please. And so in February 27th, 2020, COVID hit Nigeria, and the already weakened health system became even more weaker. Post-crash system was collapsed to fight COVID-19. As you can see in the pictures, these are health frontline ambulance workers who are responsible for moving patients to COVID treatment center. You can see the way, the manner at which they are handling the patients without minding their safety and obeying other safety protocols. This is because they weren't trained prior to their work. They weren't given adequate training. Next slide, please. And so we thought about how do we bridge this gap. This is a big issue contributing to further spread of COVID within this, frontline workers who are, most needed in the health supply chain. These are very important staffs of healthcare. So we developed the safety training, and we call it the 3-in-1. It is unique such that it hopes to empower this driver with IPC, infection prevention and control skills, and then first aid administration, as well as empower them on road safety measures because they ply the road in the course of their job. Next slide, please. So again, the project was titled Safety Training for Truck and Ambulance Driver during COVID-19. I would like to also mention that it was an ambitious project indeed. We proposed to have it in 6 locations within the 6 geopolitical regions of Nigeria. And things were a bit difficult. The pandemic had its own challenge, and we're looking forward to training 360 drivers, 60 in each of the locations. Next slide, please. Yes, so we, again, recall that I say the intention was to train 360 drivers in 6 of these locations. That was the expectation, But of course, the project had performed the initial expectations prior to the start of the project. Of course, this can be seen in the chart, which shows that an additional 26 26% of the participants were reached. Initially, again, we intended to train 360 participants, but we end up training 453 participants. I would also like to mention that we had a lot of people to train, but because we needed to ensure physical distance, needed to ensure that we do not spread COVID within the training, we had to close the door for some of the participants that we could not admin during the training. Let's slide, please. Yes, I must also tell you in terms of impact from the verbal feedback we got, from the recommendation we received from the state government of the states we had this training. In fact, one of the states, Gombe State, told us in their recommendation, in their commendation letter to us, that they haven't had this training since the existence of the state. So in terms of impact, we could, from the data we gathered, we could see that over 73.5% are shown in this chart, gained knowledge on infection prevention and control, as well as how to use PPE, and of course, how to also dispose them appropriately. Next slide, please. There were a lot of lessons we learned during the course of this project. Again, it was an ambitious project in the time of a pandemic. The already health system was stretched, So we noticed that ambulance drivers did not believe that COVID existed. In fact, in one of the states, they thought COVID was a cholera. You can imagine those fighting, being at the forefront of this fight, thinking that COVID was cholera. And in so many states we visited, we had this training. They didn't even believe that it existed. Again, public drivers in public sectors are often not provided with training opportunities. They are in the lower cadre or junior staff within the workforce hierarchy. We had a lot of them telling us that this is the first time they've been officially trained ever since they began their job. And this is worrisome, if you ask me, because these are people that are responsible for movement of goods, services, patients, and other logistics that are required for effective health system. So the last but not least is we got more demand for similar training in so many other countries like Namibia. Next slide, please. So key to our success, strong involvement / engagement with government. So we try to work with the government. That ensures that our projects are sustainable. Then we localize the training. We deliver the training in local dialect in the 6 locations we went to. And then practical demonstration in local languages. In fact, in one of the states we visited, we had a Nollywood actress who came as a trainer and also demonstrated the training for easy assimilation. So thank you so very much. That is just the summary of the training, our project, and I'm happy to answer some of the questions that may come up. Thank you.
Thank you very much, Simon, for that presentation. Really appreciate it. And yeah, I can imagine people were paying extra attention when they had a Nollywood actress as their trainer, for sure. So yes, encouraging all participants to submit your questions via the Q&A. And then at the end of this, we'll start answering questions. So with that, I'm going to move on to our next presentation, which will be from SafeBoda, focusing on the Safe Health Pharmacies program in Uganda. So I turn it over to you, Desire Pamela.
Hi, everyone. Thank you, Alexis. My name is Desire Pamela Kalisa, and I'm the food and shop supervisor here at SafeBoda in Kampala, Uganda. SafeBoda is a transport and logistics company that basically believes that everyone in African cities should have access to the on-demand health services and affordable products at a click of a button. Currently, we work with the informal boda rider, that is the two-wheeler motorcycle driver, to ensure that we deliver the last mile transportation and on-demand services to the public. We are based in Uganda and Kampala. In Kampala, we opened in 2014, but we rolled out the food and shop vertical after the COVID-19 outbreak last year. We have over 1 million customers on our application and have trained over 22,000 riders to deliver products to different customers. Our grand challenge for last mile health supply was based around connecting pharmacies to the customers in Kampala. Next slide, please. Yes. So because of the COVID-19 outbreak, whereby we registered our first case in March 2020, Kampala faced a full lockdown, which was partially lifted in the month of July, and it still remains up to date. So this led to an overall mobility and access to products and services being curtailed across a number of sectors, including the transport sector. And we saw that a city of over 3 million people face problems accessing health products, mere over-the-counter health products, and sexual and non-sexual products, non-sexual health products. And pharmacies registered a reduction in the number of sales they were getting, as people could not move to the pharmacies to purchase these products. Next slide, please. So as SafeBoda, we came up with a solution to open up a shop vertical on our application and bring a solution to connect pharmacies to customers. And we took on a 4-step multi-pronged approach that enabled, the first step we took was training and capacity building of the SafeBoda riders on safe delivery, i.e. following the SOPs and prevention of the spread of COVID-19 while delivering products from the pharmacies to the customers. Next slide, please. We also took on capacity building and onboarding of pharmacies as vendors on the SafeBoda application. And we basically trained them on the key tips on how to maximize their sales online. Some of the tips were ensuring that they had a smartphone, ensuring that they were fully branded and were well trained on the SOPs and how to use our application, ensuring that they were understood the importance of offline and online marketing, and also basically ensuring that they were having inventory checks every now and then for their products. Next slide, please. The third step that we took on was engagement and education of consumers of the new channels on how to access products online through promo campaigns that we run. From last year, for example, the menstrual health campaign, which we used to educate customers on how to use the menstrual pads that we were delivering online, and the World AIDS Day campaign, that was the Know Your Status campaign that we ran with key stakeholders here in Kampala to educate people about the importance of knowing their status and why they need to purchase the test kits. And basically, if they have HIV, they start on the ARVs, and so many other campaigns that we were running. Next slide, please. Next slide, please.
Sorry, Pamela, we lost your audio for just a second, but you're back now.
Oh, I'm sorry about that. I guess it's network. The fourth step we took was engagement of the stakeholders to highlight the value and potential of this new line of distribution. So in Kampala, it had never been heard of that medical products would be distributed through an online platform. So we had to engage the Ministry of Health and the National Drug Authority to highlight the value of the potential of this new line of distribution. And they came on board and have been working hand in hand with us to deliver the product. Next slide, please. So after over 8 months of doing this, the key results are that we have been able to onboard 31 pharmacies and healthcare vendors on the platform. We have trained over 340 SafeBoda drivers in safe product delivery. We have been able to fulfill over 4,233 orders from over 1,775 customers. And we have been able to ensure that we avail to customers 950 product SKUs on our platform in the different pharmacies. Next slide, please. We have been able to raise significant awareness of our project by featuring in a number of publications, for example, online, in newspapers, on radio and TV. And with this project, we delivered a new vertical to the SafeBoda app, which was Shop, like I earlier mentioned. This new high impact category aimed to support SafeBoda's customers, both users and pharmacists, to solve the inequity of access to the healthcare products. Next slide, please. We faced a few challenges while doing this. The first one was political unrest and violence in Kampala that has limited our capacity to scale. So we had elections in the month of January, and we have had a bit of political unrest ongoing even up to now, which has been a great challenge to us for delivering these products to customers. And we also have the challenge of curfew, which limits the time bodabodas are able to deliver to customers. So currently, the restriction on bodaboda riders is that they stop functioning at 6 p.m. So past 6 p.m., customers cannot access health products through our application, and we are fighting really hard to extend that time period to like 9 p.m. in the night. And we have seen that new insights on customer behavior on online purchasing of health products and getting vendors online. That is basically convincing them and incentivizing them to understand how to operate online and maximize sales. And we are working on resolving all these challenges. That's basically it. Thanks everyone. And Alexis, Shakib and I will be answering a few questions at the end of the presentations.
Great, thank you so much, Desire, Pamela, and really some really impressive achievements here. So congrats to your team. So we'll go ahead and move on to the next presentation, but please do send your questions in for Desire, Pamela, and her colleague Shakib. Next up is our friends from the Industrial Training Center in Zambia and Transaid. They'll be talking about building resilience in the health supply chain workforce. So I'll hand it over to Sarah.
Thanks a lot, Alexis. Good afternoon. It's afternoon in Zambia. Okay, my name's Sarah Tando Lusayo. I'm joining you today from the Industrial Training Center right here in Lusaka, Zambia, to be precise. The Industrial Training Center has been a partner of Transaid for more than 12 years now. Together, we have been providing high quality driver training to transport and logistics sector in Zambia. And also the sub-Saharan Africa, we have also penetrated the East Africa, such as Sierra Leone. Next slide, please. Our project responds to the need in increased resilience in the health supply chain by sensitizing key workers operating on the front line of the pandemic of the risk of the COVID-19. The aim was to embark a level of preparedness in the sector that are responsible for maintaining and distributing the health commodity cargo, including medicine and medical equipment. Working with Transaid, we developed a new communicable disease training module. We made sure our training reflected the latest global standards or in response to the COVID-19. To do this, our partner Transaid developed the training menu with UK industry contacts who had already put in place their own COVID-19 standard operating procedures for the workplace. We also made sure that the training was in line with our local Zambian guidelines and included prompts for our trainers to check and then rely on the latest advice from the government. This is the case when COVID-19 became better understood and the new approach in the fight of the disease which developed in Zambia. Our long-term ambition was to integrate the module into other training at the Industrial Training Center. And so the high quality of the content and delivery had to be extremely high. So the training manual was repeatedly checked and improved throughout the project. Now, it's interesting to learn that during this project, we trained about 101 trainees. Most were professional drivers, forklift truck operators, and warehouse workers. 73 of these trainees that we trained out of 101 came from Medical Stores Limited, the company mandated by law and by the government of the Republic of Zambia to procure, safeguard and distribute the medicine and medical supply across the country of the Republic of Zambia. To check this, the quality of training, we conducted a pre and post test assessment. An analysis to this showed that the knowledge was increasing by the day. It was interesting actually to discover that the best knowledge in the private sector was much more lower than those from the government contractors. This suggests the availability of specialized COVID-19 training is low in Zambia, but the need remains very high. Due to the increase in operational demands, transporters reported difficulties in releasing their drivers for training at a critical time. In respect to that, this training was unlike any other we have delivered before. Hence, we needed to be extremely flexible to work within our trainees' schedules, and I believe we have that capability now. So, like as you can see in the slide, we have the drivers who are being trained, the package which they received, that is a PPE, and the fact sheet. Next slide, please. So in addition, we developed printed information, which is a fact sheet, the one that is showing with some blue color on our screen, which is written COVID-19. That's a fact sheet we developed, targeting drivers and the health supply chain workers. These were created in collaboration with the Ministry of Health right here in Zambia, and each of our trainees received one fact sheet along with the pack of a PPE. The second fact sheet was that was designed specifically for professional drivers working in Zambia and contained COVID-19 information and key message of the road safety risks that drivers may face. To our knowledge, it is the only information specifically for the professional driver in circulation in Zambia. This highly highlights the fact that perhaps until now, professional drivers had not been seen as essential workers working on the front line of the COVID-19 pandemic response. So the fact sheet was printed and handed to more than 2,100 drivers working in all manner of transport, including the mining sector, energy, and agriculture. Further, as ITC in partnership with Transaid, we distributed digitally through the smartphone message apps to drivers 4,500 fact sheets in the field. Thank you so much. For now, Jason and I will be very happy to answer any questions at the end of this presentation. Thanks a lot.
Thank you very much, Sarah. Really appreciate your presentation. And I love the fact sheet. It's so cool looking. And if any of the attendees would like to download their own copy, you can go to Transaid's Knowledge Center and access it. So now we're going to move on to our next presentation. And just a reminder that if you have any questions for any of the presenters, you're welcome to submit those in the Q&A. Next up is Freddie, who will be talking about the integrated PPE delivery for community health workers in the Democratic Republic of the Congo. So I'll turn it over to you, Freddie.
Thank you very much, Alexis. Good day, everyone. I'm so excited to talk about the integrated PPE delivery for community health workers in the DRC. Last year, VillageReach collaborated with the DRC Ministry of Health and other technical partners and donors, including the COVID-19 Action Fund for Africa, CAFA, to procure over 5 million of health workers to enable them to protect themselves while they protect the community during service provision. So two issues came up after or even before we received the PPEs. The first one was how to ensure that those equipment will reach the end users who are the community health workers. And the second question, the issue was, since PPEs were coming from different providers, manufacturers, and different type of PPEs, including face shields, gowns, different type of masks, and they needed to be distributed to community health workers in a very small packages. So how to ensure that we have small package containing a complete set of PPEs for specific health facilities or health or community health workers. So that's we came up with this project. Next slide, please. To present some impact and the results of the project. Next slide. Yeah. Yeah. Thanks. So some result impact of the project. The success of this project was a strong partnership with different actors, including the Institute for Supply Chain Development, who developed training models through a video. And those training videos provide basic skills needed for inventory, kit building, and assembly for warehouse workers or logisticians, both at the national but also at the provincial levels. And just for your own information, there is no an academic program training the supply chains or logisticians in DRC. So this is a big gap for the country, and we identify this during the PPE distribution. So we train over 89 logisticians on basic skills needed for inventory kit building and assembly dedicated for community health workers. So the training was conducted at the national level, but also in the provincial levels in different provinces. We leverage a lot of resources, including the drone technology in one DRC province to transport PPEs to reach 12 health facilities, which are very hard to reach with ordinary transportations. In total, over 17,000 of community health workers received the PPEs to protect themselves while they protect the community. We also support the polio campaign that was in October last year by distributing over 7,000 of face shields to community health workers. So I already said over 5 million of PPEs were procured. Next slide, please. So this is some of the images of the training provided to logisticians. On your left-hand side, you can see the training image of the training video illustrating PPE inventory for logisticians, how they can conduct inventory, how they can build the small kits for community health workers, and how they can process with the line side. On the right-hand side, so the training had two components, the theoretical part with the videos, but also the practical session. On your right-hand side, these are the logisticians at the national level attending a practical session on PPE inventory, line side, and kit building in the one of the biggest warehouses in Kinshasa. Next slide, please. Next slide, please. So on your left-hand side, you can see a drone operator loading PPEs in the drone to transport the PPEs in one of the hardest health facilities to reach in Equateur province. Just to give you an example of the contribution of drones in the PPE distribution, this drone was flying in the health facilities, which is around 50 kilometers away from the drone hub. And so this may take between 6 to 10 hours by ordinary transportation, such as the road by vehicle. But with the drones, it took only 20 minutes for a return flight, like 7 minutes going and 7 minutes coming back. So that was very efficient to get the PPEs as quick as possible in some of the hardest coverage. On your right-hand side, you can see community health workers wearing the face shield that was distributed during the polio campaign to protect themselves while they protect the community. So thank you very much for your attention, and over to you, Alexis.
Thank you very much, Freddie, for your presentation, and well done. Okay, great. Well, now we will move on to the Q&A portion of the webinar. So one of the questions that came through, thanks to those who sent in questions, was for Simon. So Simon, the question for you is there an analysis that you conducted which reflects how the training led to a reduction in COVID-19 infections among these drivers? Can you tell us a little bit more about that?
All right. Thank you so much, Alexis. And of course, thank you, Sanji, for that wonderful and kind word of yours. I would like to say that, yes, we conducted a quantitative pre-test and post-test to check the level of knowledge improvement on COVID infection before the training and after the training. And as you can see, or as you can note on my presentation, we noted through our analysis, it was noticed that 73.5%, there was 73.5% improvement on IPC knowledge. However, we are hoping to check if this knowledge are sustained on a long term by doing additional analysis or working with NCDC. We currently have a database of the trainees. We have a WhatsApp group, state by state, where we discuss with them the post challenges they face on a daily basis, and we're really taking note of that. We also hope to publish some of this finding. I hope this explanation answered this question, but if not, please let me know. Thank you.
Excellent. Thanks for that, Simon. Okay, great. I believe we have another question for Desire Pamela. And so, Desire Pamela, our attendee would like to know, can you describe briefly the profit share arrangement between participating pharmacies and SafeBoda? So did SafeBoda charge delivery fees based on a percentage of sales, or did they not charge a fee at all? Or what was the plan for sustaining this service offering? So over to you.
Thank you very much, Alexis. My name is Shakib. I'll answer this on behalf of Pamela. The business model that we're currently pursuing is we charge commission to the vendors, but specifically for the pharmacy category, because it was a new category that we were working with. We waived commission as an incentive, but the plan is to introduce a 15% commission as we get the pharmacies to understand the value of service that we're providing and the amount of new business that they're getting through this avenue. So in the beginning, we had decided not to charge commission, but to make it more sustainable, to answer your question, we'll start charging a commission, and we're looking at around 15%. Just to, in comparison, our competition charges up to 30% commission to these pharmacies, so we'll still be quite competitive in that space.
Great. Thank you so much, Shakib, for providing that answer. Yes, it's very interesting, this business model, and I look forward to seeing what happens in the future with this offering, and hopefully it will be expanded to more locations, more cities. So I'd like to move on to another question. One participant has asked, in terms of the way forward, what's the future hold for these projects? Do you plan to continue them now that the Grand Challenge has come to an end? Do you have anything planned for this? And this is open to all of the presenters, so anyone can answer, just to kind of let us know what you're thinking in terms of moving forward after the program. So over to you.
I don't know if I can answer from my side, Alexis.
Absolutely, go ahead, Simon.
Okay, so on our own side, we are, because of the request for some of this training we've got, not just in Nigeria, but across other countries, we are exploring other funding opportunities to expand this training, because the impact is huge. And during our presentation, we learned that this training, some of these drivers didn't have opportunity to undergo this kind of training. So we're exploring other partnership, or exploring other funding opportunity to expand in Nigeria and across other countries of the world.
Alexis, if I may, so for VillageReach in DRC, we have been leveraging other resources to support this critical training of logisticians. So we have more recently trained in one additional province, and we are planning to continue with funding we have from other partners, from other donors to leverage during the distribution of PPEs, since we are still distributing PPEs in the provinces. So we will continue leveraging those resources, but also to conduct the training, which has been acknowledged by those logisticians that trained as very essential, not only for the kitting of PPEs, but also for managing other health commodities they are receiving. Thank you.
Hi, everybody. May I come in here as well on behalf of Transaid?
Thank you, Freddie. And yeah, please go ahead, Jason. Thanks.
Thanks very much. Hi, everybody. I just wanted to add at this stage that what was fantastic about the Grand Challenges project was it gave us this almost a controlled space to develop what was a new module during a live pandemic, which was extremely testing, and all of our other presenters here today have sort of attested to that. Right from the beginning, though, our long-term ambition was to make sure that this was done in a sustainable way, so that we've increased that capability, as Sarah said, at the Industrial Training Centre, which is a government-run institution, and that training has now been integrated as a module into other trainings offered in the professional driver training courses, which is great. And actually, it was a little beyond the scope of the project, but before we finished this delivery of this project, we actually trained 24 new student drivers just coming into ITC right at the beginning of their careers, and that's for us how we see this module continuing moving forward. So it is actually a module that's available at ITC, and that also gives us the scope then to take that out or to replicate it elsewhere. Together with the ITC and other partners, we're looking to move this module now into Tanzania and Uganda, even Ghana, where I am at the moment. So we definitely see this being able to scale and replicate. We definitely see that the relevance for this type of training is going to be long-term. Thank you.
Great, thanks for that, Jason. And if there's anybody else who would like to respond to that, otherwise I'll move on to the next question.
Sure, I'll just respond to the continuity, how we're planning to continue this project. So we have part of the training that we gave the SafeBoda riders on safe health delivery was incorporated into our SafeBoda curriculum. So that's something that's a really quick and easy win. So now every single SafeBoda that comes to join the company gets some of that self-health training. So that's a really good win. Then we also are exploring other funding opportunities to continue supporting the scaling of the program. Our biggest challenge is getting pharmacies to accept a small investment in some things like smartphones and providing a resource to allow this new channel. So we believe that if we have funding to maybe provide access to phone loans and additional support for these pharmacies, I will be able to continue this. And then the other bigger thing that we need to do is really just continue engaging the different stakeholders to support us, especially the government and the National Drug Authority, to allow us to bring our app to a point where we're able to provide enough information within the app in terms of health delivery, as well as just generally making the user experience more beneficial. And if you don't mind, Alexis, I'd like to answer the following question that was asked to SafeBoda, what we think the impact of commission will be. So right now, our pricing is still quite competitive when you compare us to competitors. So we believe that if we're able to educate the pharmacists, they'll be able to understand the value of paying this commission. And the commission is not a lot. Is 15% is a little below the industry standard. So I would believe that it will be welcome. And then the other thing that we're asked the demographic of the people using the app. So we saw that there was a lot of the largest proportion of people that use the app were young people between the ages of 18 and 25. And the biggest thing that they were accessing were sexual reproductive health products, as well as menstrual health products. And so the larger demographic of users of the app is actually female. So that really does a lot to improving access and to such a product. So we did do some analysis, and I'm happy to share this with anyone that requests that shows like the analysis shows a big difference between attitudes towards health products and how different people think they can access them. That's it.
Excellent. Thank you for that, Shakib. Appreciate it. We're almost out of time, but I just want to squeeze in one more question because there were several questions about PPE. So I'll direct this one to Freddie, but I know other projects also procured PPE as part of theirs. But Freddie, how did you ensure that the PPE, since you were getting it from so many different sources, that it was of the right quality?
Yeah, thanks very much for the question. So all the PPEs were procured through the COVID-19 Action Fund for Africa, not only for the DRC, but for 10 or 15 other African countries, with a committee which was established to ensure that the PPEs which were procured were in the high quality, and also before sending the PPEs, the specificity of the PPEs were sent to the ministry to approve if this is the quality that the country can accept. So there was no issue, because there was, in one hand, the CAFA committee was looking at the quality before the shipment, but also the country has to approve the shipment before it arrives.
Okay, thank you. Thank you very much for answering that question, Freddie. I'm afraid we're all out of time. So I just want to give another big thank you to Saul Billingsley for being here today and providing the opening remarks. And another big thank you to all of our presenters from the 4 Grand Challenge organizations. And then another special thank you to all of our attendees who took the time out today to participate in this webinar. So please do keep in touch with People That Deliver. You can subscribe to our newsletter by going to our website and signing up. You can follow us on Twitter and LinkedIn. And then if you have any specific questions for us, or you'd like to get in touch with our Grand Challenge organizations, you're welcome to email us at info@peoplethatdeliver.org. So with that, I will wish you all a great day. Thank you so much again, and see you soon.
Thank you, Alexis.